Hello, this is Sarah Banchevsky. I am the data manager with CPCQC, and this video will show you how to enter data for SOAR for the 2026 data entry form. For those of you who have participated in the past, this is very similar to what you filled in before. There's just a couple new questions and it might look just a little bit different. So this is the form for 2026. When you get into REDCap, which you'll get to by going to redcap.vumc.org. You'll have a list of your projects, and SOAR should be one of them. If you need access to CPCQC's version of REDCap and this project, please feel free to email your QI advisor and me at data@cpcqc.org. So if we click on the SOAR project and then go to Record Status Dashboard, we will see all the records that have been entered for our hospital. Right now, we're just looking at tests, and there's only one. In here is also where you can enter your hospital self-assessment or readiness assessment for time 1. And eventually, we'll also see time 2, 2026 here. But mainly the work we'll be doing here is that on a monthly basis, when our data is due, we'll come in and enter all of the NTSVC sections that occurred. Basically, what this means is that you will be transcribing each labor dystocia or clinical care checklist that has been filled in for patients over to REDCap. So some hospitals are entering this based on that paper form that they've filled in that has accompanied each patient throughout their labor. Other hospitals are working from an EHR report that supplies this data, and they're plugging it in patient by patient. And finally, we have some hospitals that are using the data import tool to pull in a very specifically formatted CSV file that contains each of these data columns in the order that's expected, and basically it just pulls the information into REDCap. It is a little bit more advanced. It does require working off of a CSV template that has specific column names and specific expectations about the values in that column. And it has to align with that or it will not import. So that's something we can talk about further if you're interested in that solution and trying to import a file. You can email me again at data@cpcqc.org if that is of interest to you. But the good old-fashioned way folks are entering data is simply by entering it here record by record. Here's some guidelines reminding us that we are really only looking for NTSVC sections, and we want a form for each patient who had that. We're also asking a new question this year, which is, was this clinical care checklist used as a communication tool for the medical team? Let's say in this case that it was. And then who was the primary labor management provider? Select one. If it's other, you can go ahead and specify who that is. Admission details, patient's age, date of delivery, gestational age in weeks and days in this particular format, the reason for patient admission, selecting all that apply. And note that if we select for induction, we're going to see additional fields come up asking us for details about that. Why was the patient admitted for induction? And we can select all that apply. Let's say this person came in for elective induction and they also had a big baby. I don't know if clinically those things can go together, but let's say which methods are used for induction and the indication for cesarean delivery. So unlike in the paper form, this question comes sooner in REDCap because it's used to basically display follow-up questions and reduce the data burden of entering your data. So if we say that the reason for C-section was placenta previa, we're not going to get follow-up questions. We're only going to see some follow-up questions for the 3 labor dystocias. If we select failed induction, we'll be asked details about that induction. If we select arrest of dilation, same, and arrest of descent, same. So that might look a little different than it does in your form. Let's say that this person The indication for cesarean delivery was arrest of dilation. Were there secondary indications? Select all that apply. So this list is shorter than it was in previous years. We've narrowed it down. We've also added patient exhaustion, and I think choreo is also new. You can still specify other reasons, but let's say that secondary reasons were patient exhaustion. Arrest of dilation details. So since we've selected this as the primary indication, we're also going to be asked about these various medical criteria to see if it was a medically kind of indicated arrest of dilation. So did the patient reach 6 centimeters dilation or greater? Yes. Did they experience rupture of membranes? Yes, artificial rupture of membranes. Did they have inadequate cervical change for at least either 4 hours of adequate uterine activity or 6 hours of Pitocin administration with inadequate uterine activity? Let's say yes. And did the patient have an IUPC placed at any time? No. So then just a reminder to double check that you filled the form in as thoroughly and completely as possible. If it is complete, you can select complete here. This is a REDCap generated field. We don't really use this on our end. This is for you to keep track of which records might need to be revisited. So if you need to come back, fill some stuff in later, or verify it, you might select incomplete or unverified. Someone else might need to look at it. We don't see people really use the unverified option often, but maybe it's incomplete and someone else needs to come fill data in, or you do later. This one's complete. And to add another record, NTSBC section, select save and go to next record. That should say record, not instance. I'll update that. And if you have no more records to enter or are ready to exit the form, you can just save and exit the form. Let's say we have another one to enter. So save and go to next record. It does give me a warning. It won't force me to fill in these fields that I left blank, but it will tell me that they are blank and they are required. I can ignore that and go to the next form. I can click OK and come back and fill in those fields, since we really ought to have patient age, date of delivery, and gestational age of delivery. So maybe I'll say OK and I'll say, oops, I forgot to put in this information. So let's go ahead and add it. All right, now let's see if it will let me save and go to next record. It's happy with me now. So now it's displaying the next record, record ID 2. It looks like that already exists in here, so I'll click on this guy. And this is some stuff you should not encounter within yours. This is based on some data I entered in the past. So that should, for those of you who on your end, should really just bring you to a brand new form where you can enter new data. So that is how we enter our data for the SOAR project, and I hope that this was helpful. Thanks for all of your efforts.